I'm David, and I'm a recovering orthopedic surgeon. Wisdom is using knowledge and experience to connect dots and solve puzzles. My management team and I at PopDoc feel fortunate. I will explain the science and the innovation we've invented in a few minutes, but it involves digital therapeutic exercise programs that incorporate a thing called fascia training. But first, I'm going to share how we got there and why we think calling things by the wrong names have prevented our progress for several years. I believe there are 6 words that are killing more Americans than cancer and heart disease combined. The medical community calls outsiders charlatans, junk scientists, and quacks as we read about their healthcare solution claims. How could we have missed this? We refers to the doctors and physical therapists involved in joint health and musculoskeletal care, who tend to assume that if we can't solve a problem, then nobody can. Chronic pain is a national epidemic in the USA. As you see it from the slide, it's more prevalent in the under 65 age demographic than heart disease, diabetes, and cancer combined. Employers spend around $1,200 per year per individual on musculoskeletal care, about 3 times they spend on the other cardiometabolic diseases. And as was just stated, there's about 1.71 billion people in the world suffering from chronic musculoskeletal disorders. The MSK, or the musculoskeletal research combating chronic pain, is suboptimal, and the answers seem elusive. But people usually don't die from chronic musculoskeletal conditions and MSDs. Instead, they get trapped in this vicious cycle involving primary care, orthopedic surgeons, physical therapy, other modalities, and they end up with consequences such as depression, opioid addiction, and loss of potential. For the last 5 years, I've been out of the operating room, due in part to a chronic musculoskeletal condition. I spent 15 operative years doing over 6,000 surgeries and getting reimbursed by the Western medical system. I now consult in orthopedics, but have been hard-pressed to look past the operating room and the acute care of people. I became an orthopedic turned doctorpreneur, and I wrote a book with a doctorate of physical therapy named Karina Wu. I have a copy here for you guys at the end of my talk, and I'd be delighted if you take it home and share it with your family as well as yourselves. And then I became an inventor, a true innovator, and then an entrepreneur. We assumed that if we couldn't figure this out, then no one can. And if you look at this slide, traditional therapies do not permanently solve musculoskeletal diseases, in such that there's about a 15% success rate. This slide compares acute versus chronic illness, and the U.S. insurance code system, CPT and ICD codes, evolved around real diseases. However, they also invented disease names for conditions or maladaptations that may do damage and lead to disease. For instance, diabetes type 1 and type 2. Type 1 is a real disease, such that your body stops producing insulin, and if you don't get treatment, you will die. Type 2, however, is not really a disease, but is in fact a condition. Too much sugar in your bloodstream due to insulin resistance. So therefore, this too much sugar in your bloodstream can cause these conditions to arise. Another example is rheumatoid arthritis versus osteoarthritis. Rheumatoid arthritis is an autoimmune phenomenon and a disease that needs treatment. Osteoarthritis, however, is more of a condition. If I liken it to tires on a car, we don't call it thin tread disease. but rather it's wear and tear on our tires. So osteoarthritis is the pain derived from wear and tear on our joints. Diseases demand a specific focus on the symptoms of point of pain, more like police work. However, conditions or disorders, they demand a focus on root cause, that is detective work. Western medicine is poor at detective work, and because there's little to no incentive to prevent diseases or injuries. When it comes to innovation, the US healthcare system is a prisoner of incremental improvement thinking, that is, building on what's already present. Perhaps it's complacency or the fear of money. Breakthrough science and transformational thinking creates true innovation. But we, channeling my old self, tend not to have an innovative bone in our body. Here is evidence of that. The IHI triple aim was postulated first in 1991 by the Institute for Healthcare Improvement. This is a silly attempt at progressive innovation. The aim is to increase population health, lower costs, and elevate patient experience. Think about how true entrepreneurs and inventors like Elon Musk would laugh at this. They would say, triple aim is the wrong wording. It really is the triple duh. Of course we want to achieve these goals in healthcare. Let's think outside the box. When it comes to an 100-year-old problem, stuck at an 85% failure rate, incremental innovation just isn't enough. At PopDoc, we feel the need to shake up the status quo about how we look at and deal with chronic musculoskeletal disorders. Remember, these are not diseases, just maladaptations that are preventable and largely reversible. We may likely be banished by our "how could we have missed this" peers. Perhaps one of you is already planning to discredit me. This is just how rigid the status quo is out there. Let's take a quick look back at some of the pioneers in postural therapy, including Pete Egoscue, a Marine sergeant, and Esther Goclay, who traveled the world and took pictures. Look at the perfect posture of the working woman, the ancient statue, and the 3-year-old child. Unfortunately, the work of the postural therapist has been rejected and not embraced by the 6 words. These pioneers taught us to look at the entire kinetic chain. Remember the old song, "Dem Bones"? The ankle bone's connected to the shin bone's connected to the knee bone. We realize that for chronic musculoskeletal problems, the solutions lie in restoring normal to the entire musculoskeletal system, from the head and neck to the toes. We also notice that the art and science of full kinetic chain postural therapy is over 50 years old, yet it never really caught on. We decided the detective work was ongoing but not complete. The answers did involve full kinetic chain, but there was something more, something missing. That something explains how Bruce Lee's famous 1-inch punch was real and not a trick. At 135 pounds, Bruce could send a 200-pound fellow martial artist across the stage with a punch only an inch or 2 in length. We decided that something, which was evident in the world of elite athletes, could be the key ingredient as a secret sauce for breaking through the 15% rate, or glass ceiling, involving and solving chronic musculoskeletal conditions and dysfunction. We feel we are onto something big. Bruce Lee's secret was fascia training, even though we had no idea what that was. We at PopDoc were inspired by Bill Parisi's 2019 book. He's an athletic trainer who's been training elite athletes for about 25 years. He was inspired by a book in 2015 that was influenced by a book back in 2001. Fascia training works best when the full kinetic chain is nearly perfect. In med school, I and all other medical students cut through and discarded this inner mesh, the fascia, during anatomical dissection around muscles, bones, joints, skin, and the organs. In reality, fascia has more nerve endings per square inch than any other tissue in the human body. So the postural therapy pioneers were onto something big. But they stayed in the musculoskeletal world. Fascia training brings in the neurological aspects of human performance. We submit that NMSK, or neuromusculoskeletal, will become the next big thing for solving chronic pain epidemic. To successfully optimize the fascia system, which basically means to restore it to its natural integrity, one must develop therapeutic exercise routines that incorporate some functional exercises. Those are at least somewhat ballistic versus slow, like an easy jumping jack. To gently and progressively tax the fascia system along its lines. There are about 7 key planes that our limbs move through as they activate muscles along fascia lines. Traditional physical therapy tends to focus on only one point of concern. PT treats patients too injured, too frail, too inflexible, or in too much pain to do functional exercises. Fascia training, on the other hand, is multiplanar and is applicable as a post-rehab or prehab tool, part of prevention and early intervention programs. However, there are no insurance codes for this yet, so it remains ignored by the Western medical establishment. Watching elite athletes perform is a huge international pastime and a robust form of entertainment. The physical agility and the actions performed are awe-inspiring. Note that when you watch an elite athlete perform, like a sprinter, his or her fingers are fixed and the opposite limbs are moving in synchrony, proving the entire fascia system is stiff and working together. I would like for some audience participation at this time. Please take part if you want to. It's called the thigh finger slap exercise. So if you care to, put your left hand firmly on your left thigh, and by only moving your index finger, lift it up and down to try and slap your thigh. Do this a couple times. So now, take the index finger of your right hand and pull your left index finger up, and then slap your thigh as you let it go. Hopefully you can feel more force and power through this. This is potential versus kinetic energy, and is your fascia system at work. So we posit that restoring primal posture and fascia integration back to how it was at 3 years old will be a key breakthrough to the 85% failure rate of curing chronic pain at any age. There are many examples of aging individuals that have astonishing musculoskeletal abilities. So age does not necessarily correlate to osteoarthritis or chronic musculoskeletal pain. PopDoc is paving the way to new solutions. We are at an early stage of harnessing the natural power of the NMSK system into digital therapeutic programs. But don't bet against PopDoc. There is disruption out there. And it began by us challenging and then rejecting the status quo points of view and the labels put on people and their neuromuscular conditions. Thank you so much for listening. And I want to give a quick shout out to the Health 2.0 conference staff for their guidance and support for all this, and to all of you as well, with the innovations and the bright future you are creating for the people, populations, and humanity that you serve. Together, in collaboration, we can create a healthier life and better health for people. Thanks. I don't know if there's much time for questions, but I am here. But if anybody has a question, I'm happy to address it.